My name is Elise Sanderson, and these are my audience members, Bree Purnell, Emily Stadler, and Al Subramanian. According to Healthline.com, little appetite, thirst, pain, fluctuating body temperature, and paleness are all signs that death is near. And one day, you may experience, or someone you love may experience, these side effects. I watched my grandpa die in a hospital, and there was nothing that the doctors could do besides wait for him to die. But today, there's something that could help. Physician-assisted death, according to the American Medical Association, is defined as when a physician facilitates a patient's death by providing necessary means or information to enable the patient to perform the life-ending act. This should be legal because patients have the right to choose their fate, the right to alleviate their pain and suffering, and because there would be many laws in place to prevent the misuse of the legalization. Physician-assisted death should be legal because the patient has the right to choose between life or death. Oregon is one of the 7 states that has legalized this and stated in its 2017 data summary that the 3 leading reasons that patients wanted to use this was because of the inability to do activities that made their life enjoyable, loss of autonomy, and loss of dignity. Although these reasons aren't pain, it still needs to be understood that for many dying people, these reasons were significant enough to make people feel the need to end their life early in order to end their life happy, which is a right that they do possess. NCBI.org states, quote, "If the right to live were only a right to decide to continue living and did not also include a right to decide not to continue living, it would be a duty to live rather than a right to live," end quote. This quote argues that along with the right to live comes the right not to live, and that decision is ultimately left up to the patient. Although it was not stated in the Oregon 2017 summary, people do have the choice to end their life based upon their pain. NCBI.gov argues the point that only the patient should be allowed to choose what is bearable. This means that the patient is the only one who feels their own pain and either makes their life worthy of continuing or in some cases worthy of ending. According to Dr. Lynn Webster, it is estimated that people who think seriously about suicide due to chronic pain is 20 to 50%. This accounts for a lot of the population that should be the ability to die in a humane way. Physician-assisted death sounds good in theory, but there are many laws surrounding it that make it the ability to be here today without many problems. To make physician-assisted death work in a significant manner, there needs to be laws in place that can make it humane. Deathwithdignity.org outlines the laws that are in place in the states with physician-assisted death is already legal. This website outlines the 4 requirements to receive the lethal drug. These requirements are an adult resident of the state where the law is legal, the people must be mentally competent, they must be diagnosed with a terminal illness that will lead to death within 6 months as confirmed by 2 physicians, not only 1, and the capability of self-administering and ingesting the medications without the assistance of anyone. Because there are many characteristics that the patient must have, it makes it more difficult for the patient to receive the drug for the benefit of the patient, ensuring that they morally should receive it. The New England Journal of Medicine agrees that there needs to be laws in place, which includes a law that makes sure that the patient is mentally capable, as I had already stated. This is because the people that choose to do this are making a rational, life-altering decision. This characteristic that the patient must have is important in determining whether death is a sound option for that the patient does desire. You are now aware of why physician-assisted death should be legal, which is because the patients have the right to choose their fate, the right to alleviate their pain, and lastly, because there be laws in place to avoid its misuse. Now that you know your possible options, you should support physician-assisted suicide for the benefit of your future self and others to have more options while on their deathbed. And again, these are my audience members, Bree Purnell, Emily Stadler, and Al Subramanian.